Do I need medication when trying to recover from anxiety? Is medication necessary when trying to recover from anxiety? These are questions I've gotten on my Facebook platform, on my Instagram platform, on my TikTok platform. By the way, if you don't follow me on Facebook or Instagram or even TikTok, the name is the same, Anxiety Recovery with Albright. So I've gotten this question a couple of times, and it is one of those questions that I shy from talking about, because I'm not an expert. I don't want to talk about medication like I'm an expert, because I'm not. In this channel, I talk about my own experience of suffering, my own experience with medication, and how I was able to recover from anxiety. So don't take this discussion out of context. I'm not implying that people should withdraw from their medications, people should stop their medications. That's not what I'm saying. I'm only talking about my experience and how medication impacted me. So when I was at the rock bottom stage, because when you're at the rock bottom stage, you don't understand what is happening. You're having panic attacks, you're having, feelings of unreality, you're having the intrusive thoughts, the physical symptoms. You literally don't understand what is happening. And the only option that is available is, medication. You go to the hospital, you explain what you are feeling. The doctors tell you, my doctors told me that I can only cope and manage, and they gave me medication. So that was the only option that was available, and I took medication. At first, I took medication. So I went home, took those medications, and I felt like those medications came with a couple of side effects. I felt more fatigued, I felt numb, I felt like a zombie. There is one time a friend told me, "What are you taking? You literally look like a zombie." So I felt, at that time I was taking medications. There were a couple of medications. I was taking some antidepressants, I was taking sertraline, I was taking Prozac, I was taking Xanax. Then I felt like these medications were not helping me, because it came with a couple of side effects, but also there are some positive side effects, like adding weight, because I was thin. So they were helping me with adding weight, and some of the medications also helped me with sleep. So I felt like the cons were more than the pros. So I went to the hospital. I explained, like, these medications, this is how I feel, and they changed me the medication. At that time, they changed me to propanol, which is a beta blocker. Beta blocker is pills that you take to help with, to help stop too much adrenaline in your body. It helps with the symptoms like, heart palpitations, panic attacks. So I took a couple of medications, but they didn't help. So I went to the hospital, they changed me. Still, I was still having the same side effects. I was still feeling fatigued. I was still feeling numb. Then I asked myself, why should I be taking these medications and I'm still, having the symptoms? Nothing has changed. The only thing there is that I've added weight. It has helped me with sleep, but the cons was so much than the pros. So I withdrew from medications. I took medications for like I think it was 2 to 3 months there. I took medications for, let me say, 3 months. For me, I went to medication as a last resort, because first of all, I didn't want to be dependent on medication for the rest of my life. Like, having to take medication every day for the rest of my life, that thought was scary. It just didn't sit right with me. So before I went to medication, I tried a couple of techniques. I tried a couple of coping techniques, like breathing exercises, the actual exercises, yoga, acupuncture, supplement therapy. None of that worked, because most of those coping techniques, they in fact, they make anxiety worse, because you're sending a wrong signal to the brain that really there is a threat, and your brain does not know the difference between a real threat and a false threat. So anything that you show, if you react in panic, anything that you show it that it is a threat, it will believe it, and it will send you more of the adrenaline surges, and you're gonna have more of these same symptoms that you're trying to run away from. So for me, coping crutches made my anxiety worse. I want to hear your opinions. What do you feel about coping crutches, like the breathing techniques, the yoga, the exercises, the therapy? Do you feel like they make your anxiety worse? Because to me, they actually made my anxiety worse. That I do breathing exercises, I don't know, I am supposed to count the number of trees around me. Actually, I don't know, I'm supposed to snap a rubber band on it made my anxiety worse. I want to hear your thoughts. Can you kindly comment down below? I want to make this clear. Medication can help with short-term relief, because even me, when I first started taking them, I felt instant relief. They can help with short-term relief, but in long-term, medication tends to numb the symptoms. And it is okay. I can't say that medication is inherently bad or good, because with some people it helps. And even when you read Claire Wick's book that says that, medication can help to remove the edge of. There are people who literally can't do without medication. So, like, literally, it helps remove the edge of. So even if they focus on desensitizing the nervous system, already they are not, sometimes for you to practice the principles of anxiety recovery, for you to even focus on desensitizing your nervous system, you need to stabilize. So medication can help you with stability. They can help in removing the edge off. So medication is not as bad. But for me personally, they literally didn't help me. And I have worked with people who have been on medication and they withdrew later. So you can combine both. You can be using medication and also combine with the natural way of recovering from anxiety. So medication is not bad. Some of you have taken medication for 5 years, for 10 years. How can you tell someone like that to, withdraw from medication? That's all they have known. And even if you work with me, when you withdraw from medication, you will do it with the help of your doctor. You will only do it when you feel like you are independent enough, when you feel like, now I can I can handle these symptoms head on. But otherwise, medication is not bad. For me, I didn't take them for long, so I don't want to talk like I'm an expert in, around medication. I'm not an expert. But from the people I've worked with, medication is not bad. You can recover even while using medication. Something also about medication, just be careful not to use them as a crutch. Now you want to work with the medication, you want to use them anytime you're anxious. By the way, I have a romantic relationship that I literally destroyed by taking those medications. Those anxiety medications are supposed to be taken at night. I remember that day I was supposed to go on a date, and I was literally really anxious. I couldn't function. So something told me, like, take these medications, maybe they'll be able to help. I'm telling you, I look like a zombie. That's the best one. And I couldn't, it made me more fatigued. I was numb, and that guy literally just told me, what have you used? And he started, making some allegations. I don't know, I was where. So it was a mess. I think I've told this story on TikTok on how, I was using medications as a coping crutch. Don't use medication as a crutch. That anytime you're anxious, you're taking your medications. Medications are supposed to be taken at night. So anytime you're anxious, you want to work with the medications, and even you might find that you're not even taking those medications. Just working with them calms down your anxiety. That one, if you're doing that, just know that you are using medication as a coping crutch. So just be careful with anxiety. As long as you're taking your medications, and also you learn, you educate yourself on the anxiety subject, you learn how to respond. You respond with courage instead of fear. Anxiety is about, changing your beliefs, changing your thinking patterns, and, the behaviors that are keeping you stuck with anxiety, changing the behaviors that are keeping you stuck with anxiety. Once you learn that, even if you're taking medication and you're applying, you're using the natural way on the side, you are okay. Later, you might be able to withdraw from the medications with the help of your doctor, because now you can handle the symptoms on your own. So it is not bad to take medication. It's just that my story may be different. So I want to hear your thoughts on medication. Do you feel like medications address the root cause? What is your experience with medication? Can you kindly comment down below? Otherwise, if you have watched up to this point, make sure to subscribe to the channel, because it helps the channel grow. Share this video to others who may need it, and also a thumbs up for this video. If you feel like anxiety has wasted your time, I have a coaching program where I help people overcome anxiety disorders permanently. If you want to work one-on-one with me, use this WhatsApp or this email to reach out to me. Even if you're taking medication or not, it doesn't matter. That's it doesn't matter. Use this WhatsApp or this email to reach out to me. You can recover even while taking medication. The thing there is to focus on desensitizing your nervous system. As a result, you will be able to heal and later withdraw from those medications. So if you are interested in working one-on-one with me, use this WhatsApp or this email to reach out to me. Otherwise, let's meet on the next video.